Today we're going to be talking about the healthcare compliance audit checklist. And a lot of this particular presentation comes from one of the concerns from varying auditing departments. Simply put, that a lot of private practice in particular are not conducting self-audits. So this is a checklist that hopefully will help you evaluate your strengths, weaknesses, some opportunities for you, and as well some things that may be a threat for you. Kind of a funny picture of workmen who are installing, these are cast iron bollards to stop nurses from parking on the pavement outside the Royal Hospital in Belfast. So here they are cleaning up at the end of the day, and can you spot why they won't be getting home anytime soon? They have surrounded themselves. So details are small. Well, who am I? You've probably seen me on LinkedIn. My name's Lance King. I'm currently the Vice President of Sales at Healthcare Compliance Solutions. And many of you have been personally invited by me or been invited by somebody in your company, or maybe just a friend who reached out and said, hey, I think this presentation could be valuable for you. Doctors, healthcare compliance officers, you're the main party of interest in this presentation, typically the individuals who are present. And so hopefully this presentation can assist you in some of your efforts as you move your compliance program forward. And I'd love to help support you in your compliance efforts if I can. Now, this is one of 12 presentations. We'll be giving just a really condensed version of what could be a very, very long presentation. But every Friday, we're going to have a webinar that will be approximately 30 minutes long on different points of compliance, different be considered in creating a culture of compliance. Now, a little bit more about me. I'm from Salt Lake City, Utah. I'm passionate about people and what people can do. I love where technology is moving. I love the innovations that are taking off in the healthcare industry. Specifically, I'm excited about where virtual reality is headed, about what can be done with predictive analytics. And so I'm an entrepreneur at heart. I love innovating and creating. I have 3 girls, and we actually have 1 child on the way due in September. So we'll see if we get another girl to complete, so everybody has a friend, or maybe we'll even get a boy to shake things up a little bit. Well, the more I've learned about healthcare practice administration, the more I learn about the lack of time that many of you have in your office. And I'll tell you, one of the reasons I'm Healthcare Compliance Solutions is because we help people do more with less. And that's the purpose of every one of these presentations, help you to be more efficient. Certainly in the beginning, it may not seem like you're as efficient because you have to start focusing on things and integrating systems. But over time, you do become more efficient, and you are able to do more with less. So who is HCSI? Just a quick kind of in short, we're a compliance partner for healthcare providers and business associates. Our mission is to help small to mid-sized practices and business associates create a culture of compliance. And we are involved with OSHA compliance, HIPAA compliance, Medicare compliance, as well as employment law. We like to focus doctors on helping the compliance officer really take on this role. I know a lot of doctors like to have control over what's happening, but with compliance, it really is best done if you just let your compliance officer do this. So that's mainly who we support. Why am I at a company like this? If you knew me individually, you'd know I have a a pretty athletic past. I'm pretty athletic and into fitness and wellness. And so, why am I in compliance? Well, at one point I thought I was headed to law school. So much so that I purchased the course. I began preparing with the LSAT, and went through and let's see, what are they called? Internship at a law firm. And at any rate, I came across healthcare compliance solutions, and soon after, I developed my why. To the right of this picture you're seeing is my daughter, Malia. Now, Malia was 4 months old in this picture, and she is doing very well now, but we went to a particular hospital. She was flown in because she had RSV, and this was 2 years ago. A lot of people had RSV. Well, we went into the ICU, and my wife is she has training and about 3 years of experience as a surgical nurse, and she knows how important protective equipment is, and that oftentimes in ICUs it can be difficult to take a gown off in one room and then put another one on, and then put another, and then take one off and put another one on, and I realized that, boy, I realized that they have to do that a lot. But when Malia was there, we were worried about how just how sanitary everything was. I mean, beautiful hospital, but we worried about Malia getting much more than just RSV. Now, it turns out she had RSV, the rhinovirus and the adenovirus, but we learned that there was another baby nearby that had pneumonia. And so that kept my wife on her toes, and me on my toes when I was there, just in terms of being encouraging to the doctors and the healthcare staff to wear their equipment, to make sure they were washing their hands frequently. Well, it turns out that many of them struggled to always do that, and we got on pretty good terms. We developed some pretty good relationships, we thought, with a lot of the healthcare staff, but still, we were very firm on wearing protective equipment, and they did struggle a little bit, and unfortunately, Malia did end up contracting pneumonia, and I'll tell you, that was a scary road, and we nearly lost her. And the things we went through, thinking we were nearly going to lose Malia, boy, if any of you have been in that position or have lost loved ones, it can be devastating, absolutely devastating. And my mission with this company has become such that I want families to be protected. I certainly care about the workers in the offices, the healthcare practices. I want them to be safe, but boy, these things impact the family. My wife was, let's see if this will come up. Okay, so it's not going to come up. I'm just going to go back to this screen real fast. I just want to say also, my wife and I have also had an encounter with identity theft, and so a year and a half of our lives was spent recouping from that, and with healthcare records, with the progression of technology, the curiosity of hackers, the goal of hackers to prove a point and also to sell medical records on the black market. Boy, this drives my mission. Here's what to expect in this presentation. Oh, I just remembered where the slide was that I was going to be looking for, but that's okay. We're going to go through the 5 most common reasons for an audit. I want to talk about some scenarios, some penalties if audited and fined, want to get into self-audit, and hopefully you'll take some notes on that and double check some things that you have and you don't have, and then get into how to establish a culture of compliance. All right. I should mention, we will also talk about providing some compliance solutions. Okay, so as I mentioned in the beginning, I realize with 168 hours in a week as an administrator, as a doctor, there's only so much that you can allot your time toward. Patients should certainly be at the forefront, the staff, the front desk. I mean, there's just so much, and oftentimes what many people tell us at Healthcare Compliance Solutions is that the glass for compliance, well, it remains empty. Just not enough time to do it all. And so I'm here to say, again, we help you to do more with less. A lot of times people talk about the things that they have to do with compliance. We're kind of we try to help do this for you. And again, we realize we're the lower end of the totem pole, but we have been helping administrators, managers, supervisors be successful at their compliance guidelines for, we've been around for 30 years. We started with employment law, and just know that this is something that you can do, and we can give you a plan. Many of you may feel this way. Symptoms could be missed. This presentation will help us that you are increasing as a result of increased number throughout the United States. OCR has talked a lot about some pilot programs that they've released, and with the administration Trump, President Trump has instituted nearly any site that discusses what the administration is doing with internet security and security protocols throughout the United States. They're, from what I've gathered and from what many people have gathered, a lot more that's being done, and the government is definitely taking audits much more serious. They won't just be hey, let me give you a call and do a quick desk audit, but a lot more audits are going to take place in 2017. There are a lot of increased apps. Excuse me, let me say that again. There have been an increase with healthcare apps. The increase of online resources for patients to access their health records, cloud storage, and the use for a lot of mobile devices to improve communication throughout a private practice. These are things that we're seeing in society. This is kind of why there's just such a great need for a culture of compliance. So getting into 5 common circumstances for an audit. The first is disgruntled, of all things. Your employees know the organization best in terms of what is taking place and what's not. A self-reported breach. Okay, and this is at varying degrees. Employee activists may anonymously contact OCR, or OSHA, or Medicare. There's also a patient's fear of breach. Patients fear a lot of things. Boy, if someone like me has been through a year and a half of identity theft, has been through having a daughter almost die, boy, fears tend to rise. And then I'm pointing out tends to be a little bit more in question for a lot of healthcare practices. So some of this presentation is geared toward what HHS is doing with or the Office for Civil Rights with healthcare. So, so what does a timeline look like if you are audited? Well, here is about a 90-day timeline. So if you're audited, what's going to happen is you'll receive a notification letter that will be mailed to your practice. You'll receive that. Oftentimes, you'll also receive an email where they want some documentation sent to them, and they'll have a website. OCR has a website where you just upload the documents that they need to review, and then they'll review everything and they'll plan for the audit field work. And in many cases, you may have everything that they need, and in many cases, at day 10, they will determine on-site field work is necessary. After their field work has been conducted, they draft an audit report providing some feedback. Then there will be some reviews, some comments on a draft, and a final audit report with the disclosure of the fines, corrective actions that need to take place. So I wanted to talk about three case studies, three of the most common things that can happen that can lead you to an audit. First is a disgruntled ex-employee. So here's, I've kind of mentioned briefly the scenario. Doctors, if you're listening to this, you may have an employee that may not show signs, but you may have an office manager that's tasked with more jobs than they can handle, but boy, they don't want to disappoint you. They have so much respect and so much gratitude for the opportunity to serve with your practice. We've heard from time to time that doctors don't, they're not ones to listen to excuses. And so say an office manager just becomes wound so tightly, and the image I have, if you've ever played with one of those, they kind of have a wire in the middle of that molding. And I remember as a kid just twisting the arms or the body just to see how many times I could twist before they would break. But you may get an office manager that they get wound so tightly that they look for an opportunity to point the finger at the doctor. And again, there's ways anonymously of reaching out to different compliance authorities, especially when it comes to employment law. Boy, that's where the big litigation can happen. So it finally happens. The doctor makes a big mistake. The office manager, maybe they could have saved them in that situation. It results in a very angry patient, a very angry doctor. Doctor has buildup of dissatisfaction toward the office manager, and that office manager, let's say they get fired. Well, the office manager is going to look at what's happened, and the blame, in many cases, unfortunately, is put to the doctors. And this is a very familiar story. Many practices are understaffed. Their people are underpaid, and people are also underappreciated. So something to consider. Then you've got the scenario where you have a disgruntled patient. Okay, so we had a story recently about a dentist, and this dentist was working with a patient that decided that he wanted to combat the price and just had a really cantankerous attitude toward the doctor, feeling like the doctor was going to work him over financially. And at any rate, this patient got offended, and the doctor tried to be as patient as they could, but made a remark to the patient that suggested that they, really didn't care if they decided to stay or if they decided to go. That he thought his prices were reasonable, and if he needed to leave, he could leave. Well, patient boiled over at that point, and this particular dentist happened to have some pictures on the wall of I guess UFC, Ultimate Fighting Championships, and the doctor was pretty lean, I think. So the patients said, something along the lines of, do you think you're tough? And at any rate, he got out of the chair and he got in the face of the doctor and repeated to say, you probably think you're real tough, and so the doctor, he egged it on a little bit to where the patient went out into the patient room and yelled some expletives, and at any rate, this doctor just didn't keep his cool. Now, I heard about this just because of dialogue that was in a dental forum, and the dentist was just trying to determine if he was in the wrong with some of the things that he did. It sounds like he kept his cool for the most part, but the fact that he came out and said, "I don't want your business," with somebody that was a little bit more heated, it just kind of blew up in his face. So like that. You just never know what somebody could do, how something like this could turn out if they've had a situation in the past where they were part of a breach in some way, or maybe they just read something on the news that it spiked their awareness that say dentists weren't sanitary, they weren't performing proper sanitation protocols. Then the next thing you know, they could be audited. So then the third one is the lack of security protocols, and this really is a big one. Of course, with this is HIPAA, and so recently you may have seen in the news that a security encryption software received a $275,000 fine, telling this practice management company that their security protocols were just not meeting the expectations. But they didn't listen. Did listen after the fine. Unfortunately, it had to get here. And I bring this up, what is the real issue here? Is it really the fine? No, it really has to do with what's happening with patient records and the lack of security protocols. Now, you'll see everywhere that applications and software, a lot of people are boasting that it is HIPAA secure. Now, that doesn't make a practice HIPAA compliant, but certainly it moves them on that road. Now, when security protocols aren't in place, patient records can be breached. Things can be leaked out onto the internet. And in 2009, there was a report that I went through that said that almost 30 million patient records had been stolen. And that was according to InfoSec, the InfoSec Institute. And that was in 2009. Okay, I surfaced that just to let your imaginations wander a little bit. We live, things have advanced a lot more in 8 years, and so keep in mind that stolen patient records can fetch as much as $363 per record, and that's kind of what has been discovered from the Poneman Institute, some of the data they collected, and that's more than any piece of data from any other industry. And this is really valuable information that they're gathering. Why? Is patient information considered more valuable than financial information? Well, stolen credit cards, they can be canceled. Fraudulent charges, they can be disputed. The process, though, for resolving medical ID theft, it's very complicated, very interwoven. Now, so here's some of the penalties for HIPAA. I mentioned I was going to place a little bit more emphasis. So the penalties do vary. Category on the left and penalty per violation on the right. Okay, so that's not just a penalty of just $100, but that's per violation. So know that if the office is found to be in the state of noncompliance with HIPAA regulations, but let's just say, for example, the administrator and compliance officer, they do make some attempt, but just didn't know what to do to correct and mitigate risk factors. That's where we're at up top, where it's the did not want to do. Okay, and so $100,000 to $50,000 per violation. One of the violations that's surfacing the most right now that, I was listening to a podcast with the director of OCR, of HHS.gov, mentioned that business associates are one of the leading causes for healthcare practices to receive fines. So just keep that in mind. Another example, so if the office is found to be in a state of noncompliance with HIPAA and the attitude sensed by the compliance auditor is, I don't care, the attitude is I'll never get audited, so why should I do this? That's where the fines move to willful neglect, not corrected. So these fines will add up quickly based on the number of violations, and it's not uncommon to see fines and settlements over $1 million. Now, a lot of people I've talked with say, I'll just pay the fine, kind of like tax time. I'll just pay the fine for not having insurance, and that's certainly an attitude to take. But let me just say, when we look at fines, it's not so much about fines. Boy, it's about your reputation. I think that's really what can kill you is the reputation. So some things to keep in mind. Well, let's get into the self-audit. Please, I hope you'll have some notes out. I hope you'll be taking a few notes so that you can identify with what you need to be strengthening. So just in kind of an encapsulated nutshell, okay, picture, a shell just opening up, and this is what you find. So in this matrix, you see at the very top, policies and procedures, ongoing docs to the right. Continuing clockwise, we have training, we have business associate contracts, risk analysis and risk management action plan, security incident and breach management. Now, here we have 6 main areas. Okay, and throughout the 12 weeks of webinars, I'm going to unpack more of these. I'm happy to answer some questions for you. If you have any questions, you can write them in the comments below. Suffice it to say, there really are some things to consider here. A lot of people I've visited with have indicated that they have a compliance program, but that their compliance program just simply is communicated. It isn't something that is robust. It's not something that's formal. That's what I hear more often. It's not a formal compliance program. So just a couple of things. Policies and procedures. You can buy policies and procedures. In fact, part of our company, we do have the binders we send have policies and procedures done for you. But what I'll say with that is the policies and procedures, there's still areas you need to customize. I have gone through forum after forum where I've discovered somebody bought a bunch of binders from an association, only to find that there were many pages where they had to write in and try to understand what the policies were surrounding different areas of compliance. So the work's not done just because you pay for it. That's a lot of the reason why there's so many compliance companies out there that will actually help guide you through and in most cases create the policies and procedures for you. Ongoing documentation. There are a lot of forms involved. There are forms such as just a self-audit form that should be evaluated quarterly, perhaps. There are forms that patients fill out. There are ongoing to be implemented throughout the year. There's also something I'll just say with HIPAA, if an auditor came into your practice and they looked at your training and only saw that you had trained once a year with HIPAA, well, you would have corrective action. They're looking for ongoing training, something where staff, as things continue to change, they're brought up to speed on the things that need to be changed. So training is something that it's, Medicare, they require every year. It's kind of a once a year, but make sure that you're sitting down with your staff and communicating the procedures. Here's how we're going to implement this policy. Here are some situations that we've come across where we almost had a disgruntled patient, and having an open discussion, and perhaps this is already part of, say, a Monday meeting that you have with your staff. Okay, make sure if you have those meetings that you're having people sign a piece of paper that says they were there and put a date stamp. Business associate contracts. These are becoming very, very important, especially as I've mentioned, so many practices are getting caught up in massive numbers of breaches because some of the business associates that they have had relationships with are not HIPAA compliant. They're not implementing security protocols. They're not following HIPAA in keeping the records, and they may only have a couple records from your practice that they need to work the relationship with you. But laptops are being stolen. People have had just so many variables, so many variations on how business associates have breached some of their patient records, and now they're being audited or under investigation for something. So please have your business associate contracts updated every year is my recommendation, our recommendation, excuse me. Your risk analysis and risk management action plan. Risk analysis should be done annually. This is one area that HHS, the Office for Civil Rights, are focusing and cracking down on. This is one of the most important reasons why they've been having these pilot audits. They're in stage 2. They're finishing stage 2 audits right now, desk and on-site audits. And one of the major things is this risk analysis, which looks at the facility risk factors, it looks at IT risk factors, it looks at environmental and certainly you've got to have an action plan. You've got to have IT. You've got to have things implemented and regularly assessed. Okay, what happens with when you have a security incident or a breach? What are you going to do to manage that? What are your procedures in that case? Okay, breaches are more common than you think. And again, it goes back to ongoing documentation. And if you're audited, that's what auditors are going to look for, is ongoing documentation with dates showing continuous improvement. Okay, now this is a process, and we realize that. But in this process, evaluate where you're at, identify the health of your compliance program, how things are being communicated, how things are being updated, which forms you have, the awareness that your staff and the patients have on what you're doing with their health records, with their safety. This just impacts your reputation. And I'll tell you, I've gone into so many healthcare practices that just don't have anything implemented, anything that's formal. When I go into healthcare practices, this is a compliance health checkup sheet that I review. It's the most simplified checklist available, and I can email you this if that helps. Perhaps something that you can quickly review. And you're welcome to take this and take a look at your training program, for example. Do you have training certificates? Do you have sanction policies for violations, which just is another way of saying, do you have consequences? And if so, is it in a stage 1, 2, and 3? Is it tied in with your HR program? What are you doing for ongoing training? Who's leading out on that? Who can be looked at to answer questions? What is the training on business associates and that relationship? And are business associates receiving training? So at any rate, something to keep on hand. And again, I'm happy to email you, and I have my email that I'll put at the end of this presentation. So how do you create a culture of compliance? What is maintenance? When you look at a culture of compliance, I'm going to tell you. But first, let me just put a couple of the things out there. Okay, so with these 5 things, I just wanted to share a quick story with you. So there was a healthcare worker, Catherine, fired from the University of Iowa Healthcare Center for violating the privacy of a pregnant female student. I don't know if this has ever happened to you. So it was a pregnant female student and her well-known student-athlete boyfriend. So Catherine had been working at the University of Iowa Health Center for 14 years, and she had received HIPAA privacy training. Unfortunately, maybe it needed to be communicated in different ways, but she was in a situation where she revealed out loud to at least one nearby coworker that she hoped the young couple was happy with the positive results of the pregnancy test. These young students. So Catherine went so far as to even point the student athlete out to the clerk after she noticed him in the waiting room. She also took another step forward and inappropriately accessed the patient's chart at least twice, opening the records from past visits and even the medication records. So what did the clerk do? The clerk had also had training. The clerk went and spoke with 2 medical assistants. The 2 actually that had treated the female student. And the clerk asked about the couple's reaction to the news of the positive pregnancy test. Well, this led to the medical assistants reporting the inquiry to a manager as a possible privacy violation. And that, of course, led to her being fired. So, deliberately create a culture that emphasizes protected health information, confidentiality. And you can do this in a number of ways. You'll see I have patient-provider relationship, identifying that, training on PHI safeguards, easy reference of policies and procedures, okay, something maybe in different rooms, different areas of your practice, some procedures that can just give people a quick reminder addressing staff on a regular basis, and then reassessing job functions. I like Dave Ramsey of, if you know Dave Ramsey, he's the guy that has the radio show on Financial Peace University, about what are called key results areas, or the KRAs, where he ties people's job roles to some key results areas. And that's how he keeps his people accountable. Well, when you're doing these KRAs and these interviews, reassess the job functions and make sure people are aware of how compliance relates to this. Okay. So speak often about the importance of trust in the patient-provider relationship, and focus on these things, and I think you'll be amazed. Now, this is a process, this culture of compliance. That's why it's called culture. And with any process, you'll add and detract from different things that you do, but the culture as a whole will communicate in several different ways whether or not things are being implemented and whether it's being successful. So assess that and take note. Well, I want to get into some solutions. Specifically, our solution for OSHA, HIPAA, Medicare, and employment law and HR, where we make the pieces fit so that you don't have to. And really, I think you'll be amazed. So I want to talk about our solution. I want to talk about some options before I introduce our solution. First, just remember that in any compliance solution, there is a security risk analysis that you have to have it. I know a lot of companies out there will just sell you on security risk analysis if that's all that you need. I talked with somebody on the phone a few months ago. They said they paid about $1,000 for a security risk analysis. Okay, so something to keep in mind. And the security risk analysis, that's where I encourage anybody to start that just wants to do compliance in-house. Okay, just make sure you're getting a 360-degree view on all of the variables. Okay, and I could even send you a sample security risk analysis if that can help you. And I won't charge you. Okay, so also consider your training options. Now, we provide online training, and that for some people works, for some people it doesn't. But you really have to take a look at your options. Sometimes people like the consultants. That can be a little bit more expensive. So really the options are a consultant, in-house, online, and actually the other one I didn't put is at least for training, you can go to seminars, but seminars don't typically help you create your policies and your procedures. They may allude to how to do certain things or suggest that you should have certain things, but in terms of walking you through and being the guide, a lot of times there's a separate service fee for that. So consider that, consultants, in terms of a financial standpoint, I know if I was a doctor looking at this, you've got all these other fees. Consultants might not be the top priority, especially because they take a lot of time. The consultant can't be your compliance officer unless they're, coming every quarter to train and implementing the documentation. And I mean, there's just a whole laundry list of things that need to be done on a regular basis. You might be able to have a consultant work with somebody who you title a privacy officer, and they may be able to coach them through ongoing internal compliance responsibilities. But again, that may come with more of a price than you want to pay. Okay. Huge plus is to do things all in-house. Okay, you really can do all of this. It's just you just have to have the time, and that's sometimes where people struggle most is just having that time. So in the middle, and kind of how we've surfaced is we're an online option. And so the things to expect, really, we try to keep things pretty simple. There are 3 things that we do to help medical practices, business associates develop a culture of compliance. And we do this with a membership website portal where there's an administrator that adds the staff that can see reports of who has and hasn't trained. All the forms are there. The risk analysis is in there. Okay, a bunch of things in the website portal to help you to stay up to date. The second thing is compliance binders. One in particular is called the Compliance Plans Binder. And if you're ever faced with an audit, you just hand this binder to an auditor and it would have everything that the auditor needs. And then with the ongoing support, number 3, the ongoing support, I just wanted to share a quick story with you. So years ago, we've had to make this a little bit more robust, the ongoing support. We've emailed and we've mailed information to our customers. And we've waited for phone calls and we've waited for emails. Problem we've discovered over time is a lot of times people will take a month and they may get jazzed about compliance. They may start implementing compliance procedures, but then something else comes up and 6 months goes by and they completely lose track of what's being required for compliance. And so what we've determined is the best thing we've implemented in the past few years are implementation specialists, a compliance coach that can help mentor the individual that's supporting your compliance program in the practice. And if that individual forgets after 3 months of implementing compliance, well, we're going to give them a call every quarter to make sure that they're aware of how to communicate a culture of compliance, which forms to be filling out, reminders about the risk assessment, reminders to implement certain protocols. In short, somebody there to to make sure that the support and the reminders that you need throughout this process of incorporating a culture of compliance. So as far as training, we do HIPAA, privacy, security, OSHA, Medicare, and employment law. I should go back and say that's for new employees and for retraining every year. Okay. Now with compliance officers, and I'll get into this in a second, there's also a section for them. And you can add and delete the staff. And also, and by the way, that's helpful. In the past, people have said, hey, we go to a seminar, and with a new employee, we can't necessarily send them to a seminar right away. And if we do, that can be kind of an expensive thing. And also, if people have come into the office, sometimes that takes a little bit more time. The office has to shut down for that individual to train staff and update things. So some things to consider. With the manuals, there's a reference guide that we provide. There's a compliance plans binder, a certificates binder, and actually recently we've now got a business associates binder. Okay. Now, why all the binders? Well, big binder lumped together, you may go into hypnosis and kind of blur out for a little bit. But we've determined that if we have these individual binders, then hopefully you'll open them separately from time to time and add to them. We've talked about the support we provide. We do weekly and monthly updates. We do a quarterly newsletter. The quarterly newsletter is mailed, and you're actually seeing exactly what it looks like in that picture. The phone and email support, and the quarterly assessment. Now, that's that implementation call where we assess the account, we make recommendations, and we determine ways that we can help support you in your compliance efforts. There are lots of forms. I've mentioned that. And here's just a quick list. But a lot of these forms are things that, again, they're the notice of privacy practices. That's something that should be given to every single person, every single patient that comes in. So you've got a customer testimonial in front of you. I thought this was a good testimonial if you're interested. It says, our HIPAA and OSHA compliance was a huge concern in our office, especially after one of our employees filed a complaint with OSHA. We started using HCSI 4 years ago and couldn't be happier with the program. It's simple to set up and easier to use. Do yourself a favor and sign up. It will make your life easier. Yes, that is exactly what we're trying to do. We're trying to make this easier for you, trying to protect the patients and the practice. This one's kind of fun. HCSI kept my fanny out of the who's cow with a cranky, which is interpreted to mean bit weirdo / psycho patient who thought we had been naughty in multiple ways. Our association with you all made the difference. We passed the inspection with flying colors, and OCR told the patient, loved it. Okay, so those are some real examples of what can happen with a disgruntled patient, what can happen with a staff member. Now, we do offer a 30-day money-back guarantee. If you start the training and you start implementing things and don't feel like we support you well enough, sure, we can, we're more than happy. I mean, we're a place of integrity, and a lot of our people here, we've gone through some things. Okay, we understand that that it's important to implement a culture of compliance, and we know that it takes time. But just so you know, this is something that we do offer. Now, just a price breakdown on our whole package. $250. There's a compliance officer training, and we felt that that's valued at $250. I don't know any other training program out there that provides specific compliance officer management training to learn all of the duties of a compliance officer. I don't know if you could go to a training seminar and find that off in the corner they have a compliance officer training. So often we talk with compliance officers, and they just don't they don't associate. The office manager doesn't associate their role as a compliance officer, and a lot of that's because of lack of education. So we make sure we partner up with the implementation specialist and the compliance officer in coaching and training to ensure they understand how to communicate a culture of compliance, and they feel like they can have a little bit of autonomy, feel like they can do things independent of our company. Employee training online, $500. Risk analysis, $250. Customized compliance plans. Go out and look for something that's customized. Usually that will allude to a pretty robust software program or a consultant that will come in and charge you about $600 a day. Okay, that's pretty industry standard. It's about $600 a day. Customizable forms, posters. Okay, you can buy all these things independent. And kind of a la carte places, and then phone and email support, and that's kind of like a consultation with a consultant. So what we're willing to do is provide a 24-hour discount. Now, you have two options with us. You can pay for 5 years, and it can come at you as a discount at $2,600 as a base, and then $3 per employee, and you'd pay for $3 per employee. Let's say you have 100 staff members, you just pay $300 per year for those employees. Okay, so keep that in mind. Or you can start with just 1 year, $1,189, and if you have 50 employees or 20. 20, you'd pay $60 plus the $11.89. Okay. So we invite you to give us a try. Like I say, there's a 30-day money-back guarantee. If you need that. I've never seen anybody have to get a refund since I've been here. But we'll give you $300 off. All you need to do is email the emails at the bottom. It's lking@hcsiinc.com. Please have integrity when I say this next part. You're the only one that's going to know. So I'm going to say that if you're watching this for the very first time and you email me within 24 hours of watching it, and it is just your first time, then we can honor that discount code. All right. So please email me. We'd love to be your support, specifically the support for your compliance officer. They've got a lot going on, but I think you'll be amazed. Doctors, as we train this compliance officer, this is you trust them with a lot, but boy, you'll be amazed on how they're able to incorporate this culture of compliance, how it helps to elevate the efficiency in the organization, a culture of communication. You'll find HR principles are integrated. In fact, one of our specialists here is an HR professional, and so that's kind of a bonus if you get him as your implementation compliance specialist. Right now, this is what many of your policies and procedures may look like. Okay, you've kind of got you've done a little bit here, a little bit there with your procedures. You've written down a few things, but nothing really that formal. We'd invite you to allow us, especially again, as you consider a culture of compliance, as you consider a compliance program. Right now, compliance might be on the mind, but in a couple of months, it's out of sight, out of mind. Let us be your support. Let us be your support system, and we'll call you every quarter. We'll do an assessment. We'll help you identify with the most important, most critical components of this culture, of this compliance program that is yours. You do own it. Okay, it's not ours. You're buying your own compliance program here. My name is Lance King. Again, here's my email address. Email me, and within 24 hours, I'll give you a discount code, and we'd love to support you moving forward. Grateful that you've made some time. We have 12 more. If you decide you want to do compliance in-house, if you want a refresher, if you're a customer of ours already and you're wanting to just reinforce things, we'll continue to have these compliance webinars every Friday at 2 p.m. Mountain Standard Time. This has been the 2017 Healthcare Compliance Audit Checklist. And to see the schedule, connect with me on LinkedIn. My name is Lance King, and I hope you make it a great day, a great weekend. I look forward to connecting with you soon, and I appreciate your time. Thanks for joining us today.